Hello, welcome to your annual Skills Day. For this portion of the course, we will be discussing the topic of safe patient mobility and fall prevention. The objective of this course is to define what a fall is and to learn what we can do to prevent them. To learn how to properly set up walkers, crutches, and canes, to learn the proper use of assistive devices and gait belt, understand the adverse effect of lack of mobility in patients during their stay, and to understand the use of Banner Mobility Assessment Tool, better known as BMAT. A fall event is defined as an event that results in a person coming to a rest inadvertently on the ground or floor or other lower level. The death rate associated with fall in the US has increased to 30% from 2007 to 2016 for older adults, and it is expected that there will be 7 fall deaths every hour by year 2030. Falls among older adults are very costly, amounting up to $50 billion annually. Furthermore, the research suggests that 25 to 30% of community-dwelling older adults of age 65 years and older will fall. With the increasing trend in falls in older adults, fall prevention becomes even more important when they are admitted to the hospital. Then, to prevent falls, do we just keep patients in bed for safety, not mobilizing them? There are numerous researches in medical field regarding acquired weakness in hospital. According to a study in 2002 in JAMA, at least 25% of patients who were on vent for 1 week or more developed such weakness that they were unable to lift their limbs against gravity. In 2015, a study in clinical care medicine reported ICU acquired weakness is associated in poor outcomes including death. In a study by American Academy of Nursing, up to 65% of adults who are independent prior to admission will lose their ability to walk during a hospital stay following prolonged immobility. According to a research in American Academy of Nursing, older adults developed weakness and dizziness in just 48 hours of admission due to taking less than 15% of steps that they would normally do outside of hospital. In another article, it was said that 30% of older adults who lose their ability to walk become permanently disabled following discharge. In order to mobilize patients, we need to use the right equipment. One of the fundamental equipment we have is front wheel walker. When you set up a walker for a patient, be sure to first have the front wheels face outside. Set the walker height so that when the patient is standing with it, the elbows are slightly bent. An easy way to do this is to have the patient stand and have their wrists fall on the height of the top of the walker. The standard walker we have weight limit of 300 pounds, and a bariatric walker has a weight limit of approximately 550 pounds. Next device in your toolbox is crutches. For crutches, each side has a weight limit up to 300 pounds. When you set up crutches, the top of the crutches should be 2 inches or 2 finger width lower than the patient's armpits to avoid compressing the brachial plexus nerves. To adjust for this, you may need to adjust the handlebars to allow for slight bend in the elbows. Overall height is adjusted from the bottom of the crutches, and they are labeled to match the patient's height. Next tool you can use is single point cane. You may adjust the height so that you allow slight bend in the elbows when the patient is using the cane. The most crucial equipment that you can use when moving patients is gait belt. There are belts distributed throughout the hospital. However, in those cases when a patient received abdominal or back surgeries, you may place them at a higher level to avoid interfering with the surgical site. You should never lift the patient with the gait belt. While the belt may provide some level of lifting assistance, it was never designed to be a tool to provide total lift for the patients. Please keep in mind, any misuse or non-use of safety equipment mentioned can make you liable for patient safety in an event of fall or injury. In addition to assistive devices, we need to be sure that patients who are at high risk for fall have yellow socks, yellow wristbands, wall sign, and bed alarm on. In addition to the assistive devices, we have mobility devices in which we can provide assistance. All of you are signed off on the use of the lifts at initial orientation. If you have questions or need additional instruction, Rehab Department is available at extension 4229. Next topic we will discuss is the Banner Mobility Assessment Tool. BMAT is designed as an assessment tool to test patients' ability to move safely in hospital setting. The patient must complete and pass each level to progress to the next lower level of assistance. Overall, the assessment should not take more than 5 to 10 minutes. When you enter a patient's room, assess to see if the patient can roll themselves to one side and sit on the edge of the bed with the feet touching the ground. Greet them and shake their hand to see if they can maintain balance while sitting. Although not necessary, ask them to switch hands and see if they can do with another hand as well. If the patient is able to do this, then progress to level 2. If the patient fails, the patient is at level 1. Next, see if the patient can point their toes forward with the knees extended. Repeat this on both sides. If the patient can do this without signs of loss of balance, progress to assess for level 3. If the patient fails, the patient is at level 2. Next, see if the patient can stand with the feet at either shoulder width or close together. If they're not able to stand without assistance, try it again with the walker. If you see that the patient is stable for 5 seconds, progress to level 4. If the patient fails, the patient is at level 3. At level 4, see if the patient can perform standing marching with or without an assistive device such as a walker or cane. If the patient is able to march, see if the patient can walk to the door or take some steps. If the person can complete this, then the patient is at level 4. If the patient fails, the patient is at level 3. At each mobility level, there are suggested equipments. At level 1, a Hoya lift and fall bundle is recommended. At level 2, a sit-to-stand lift and a fall bundle is recommended. At level 3, a sit-to-stand and a fall bundle is recommended. At level 4, the patient is modified independent and may ambulate with just supervision for safety. That concludes the physical therapy portion of the annual skill day. If you have any questions, please don't hesitate to call extension 4229 for assistance. Thank you.